The last remedy we spoke was opium. Okay. Very quick questions in opium. If you have anything to ask in opium, we'll take up the questions, your doubts. If things are clear, then let's not waste the time. We can start with the new remedy. See, two remedies I told you, like for example, chelidonium and opium. They both belong to a common family, Pathogenesis. Okay. Today we'll be starting with a new remedy. So the remedy that we'll be discussing today, as usual, a post-lunch class, we'll just start off with a small interaction, and then I'll unveil the remedy that I'm going to discuss today, and then we'll talk a part of the remedy today. Okay? So a quick question, hope all of you settle down. A quick question. Now what is the question is, as a second year student, what remedies can you recall? Okay. Remedies that predominantly act on the mucus. As well as, see, the question is remedies acting on the mucous membrane. The question is, tell me the remedies that are already over. That is not the question. Don't tell me all remedies. You stick to this question. Remedies predominantly acting on the mucous membrane. Okay. Somebody said bryonia. One was talking about arsenic. Somebody was talking about aloes, calibrom, acetic acid, alum cipa, euphrasia, alumina. Okay, very good. Opium. Okay, opium, then colchicum. Okay, colchicum. Pulsatilla. Colchicum, pulsatilla, opium. I mean, lot of remedies. Lot of remedies. Okay. So we'll take a few remedies for discussion, and then we'll introduce the remedy that we are going to start. Okay. So for example, if it is bryonia, what do you see in bryonia? Bryonia. And the remedy that your friend also contributed, alumina, that also has dryness. So bryonia and alumina, they act on mucous membrane and they cause more of dryness. Okay. And what happens in alum cipa? Alum cipa. Okay, it causes an active discharge. But also remember, the affinity of alum cipa is mainly for nose, and it also acts on the eyes and the upper respiratory tract predominantly. In euphrasia, it acts on eyes, and the second priority will be the nose and the upper respiratory. Okay. So now the question here, why I have just come up with this question is, the remedy that I am going to discuss today is also a remedy which predominantly acts on mucous membrane. But I want you to have a clarity. Though you have contributed some 8-9 remedies, all 8-9 remedies are different. Okay. And the remedy that I am going to talk today is also different. Okay. They all no doubt act on mucous membrane, but what will they cause acting on mucous membrane becomes very important. Right? Like one of your friends was contributing arsenic. What do you see in arsenic? What do you see arsenic? What do you see in arsenic? Acting on mucous membrane, it causes inflammation and it can cause ulceration. Right? Okay, it goes one step ahead. So similarly, we are going to introduce a remedy. Okay, is it done? Okay, thanks to your pharmacy, sir. Very good. I'm happy. I thought you would tell me sample. Case reporter. Okay, which we commonly use for a dish in Karnataka. Okay. Case reporter. I'm happy. The North Indians are showing case reporter. Very good. Okay. Anyway, so I'm happy that you could think of Kali bike. Good. So you made my job easy. Kali bichromicum is what we are going to discuss today. Okay. So 40 minutes. We have our own objectives. We take a focus on those objectives. But for time being, Kali bichromicum is which family? Kali family. Okay. And it belongs to which source? see this mineral source, potassium bicarbonate, bichromate, sorry, potassium bichromate is the common name, and that is the formula K2Cr2O7. Don't worry about it looks like a vehicle number. Okay, but the 2 should come down. I mean, some grammar, typing error, don't worry. Prover, Dr. Disdale of England. Disdale, he was the person who proved Calibic, okay? And you said it's a mineral, and naturally the preparation, if you are looking at the preparation is by trituration. See, being a mineral, you know it is a deep acting remedy. Majority of the minerals are deep acting. So is Calibic. It's a deep acting remedy. Is Calicarb done? So if Calicarb is done, then you will also get a small clarity. There are something very common. Okay? The Papaveracea family, you had Chelidonium and Opium having some similarities. The Cali group will also have some similarity. Okay? So we will go slow, and for people who are joined late, the remedy that we are discussing is Calibic. Okay? It's a mineral and it is prepared by trituration, and these are all the nice to know part of Calibic. Now important, what is it that as a student you are going to get in the next 40 minutes? What is it that as a student you are going to get for next 40 minutes? See, 3 small objectives, nothing great, nothing big, 3 small objectives. First thing is we are going to look at this area, and I have been insisting, this is my 5th remedy for you in 2nd year, and I have been insisting this area is very, very important. The sphere of action and pathogenesis is super important. Okay, so we will see where exactly Calibic acts, that is the sphere of action, and acting on that particular organ, what is it producing is what we call it as pathogenesis. This I have been repeating in every class, but it is very important. The second objective for today is we are looking at the ailments now. Chelidonium, Opium, Bellis, Asculus, 4 remedies we have done. Each of these remedies, they had their own causative factors. So we are also trying to understand what are the causative factors in Calibic. Okay, that will be the second thing. And the last thing, we will be looking at the characteristic symptom. What is unique? What is peculiar? What are the symptoms which are standing out? That is what we call it as the characteristic symptoms. So very simple objectives for today's class. We will go step by step, we will go slow, so that all of you get a very good clarity of Calibic. Fine? Okay. So the first objective is the sphere of action and pathogenesis. Okay. Sphere of action and pathogenesis. So what is it that you see here is it is having an affinity for the mucous membrane. Again, mucous membrane, 2 very important areas you see Calibic affecting from your knowledge of anatomy, that it is affecting the GAT and the respiratory tract. Very good. So the images are very clear. It is affecting the GAT and the respiratory tract. Okay. So acting on this particular area, what is Calibic doing? Right? That is pathogenesis. So what will Calibic do is, see, it can cause simple inflammation. First thing is it can cause inflammation. Second very important thing is it can give rise to growth. It can give rise to growth. So any vague area, what are the growth related to mucous membrane called? Very good. Knowledge of pathology. If you apply the knowledge of pathology here and if you integrate, what do we see is the growths that are coming from the mucous membrane, they are called as polyp. So here you see polyp, okay, in the nose, polyp in the rectum, polyp in the intestines, and the very important thing is ulceration. So what is it that you are understanding from this slide that I have shown you? That what is that first thing that is coming to your mind? What is it that is coming to mind? That it is a very deep acting remedy. See, much of miasms are not over for you in second year. Otherwise, please remember, inflammation is what we call it as psora. Anything where you see growth, we call it pathogenesis. Ulcer is what we call it as syphilitic. So this is a remedy which has psora in the background, psychosis, and you also see syphilitic miasm. Okay, it's very, very important. Okay, so simple inflammation in the, you can also see polyp, and you can also see ulcers coming up. This is the first area, and the second area, if you just focus on the PPT, very good cartilage, or we can make it more generalized. Though I have got you the image of cartilage, what I want is it mainly acts on the fibrous tissue. Okay. So which are the remedies acting on the fibrous tissue? Ruta, very good. Ruta, symphytum, Rastox, very good. And you also have silicea. Right? Okay. So you see this remedy acting on the cartilage. What is it that this remedy does acting on the cartilage? It causes destruction of the cartilage. Okay. See, in ruta, in symphytum, in Rastox, we don't see destruction. You might see maximum inflammation. But here you are seeing the cartilage is getting destroyed. So that is the power of calibrate. Right? So cartilage is getting ulcerated, cartilage is getting destructed. The second fibrous tissue you see calibrate acting is the periosteum. Okay? Right? You have the periosteum here, the membrane which covers the bone. Which are the other remedies? Ruta, symphytum. Okay, and of course silicea. So acting on the periosteum, what you see is it can cause swelling. Okay? So swelling acting on the periosteum and destruction acting on the cartilages. So we have just started with the sphere of action and pathogenesis. And two areas we have focused here. The first area is mucous membrane, okay, of GIT and respiratory tract. Clear? It causes inflammation and it is also causing growth or it can cause ulceration. Second area is the fibrous tissue where you see this causing acting on the cartilage and the periosteum. On periosteum swelling and on the cartilage destruction. Okay. We look at the third area, kidneys. Okay. What remedies come to your mind when I say kidneys? Lycopodium, Apis mellifica, berberis, sarsaparilla, hydrangeum, very good. Naxxramica, good, beautiful. I'm happy. Calcarea, belladonna, aborigine. Opposite, very good, very good. Lycopodium, yes. Lycopodium dubara. No problem, must be in here, Lycopodium, good. But I mean, there are many remedies. What will this particular remedy do acting on kidneys? Calibrate, a deep acting remedy, a mineral. So it can cause as simple as nephritis, inflammation, or you can see a deeper pathology happening here, wherein there are cases where the stalwarts have seen calibrate doing wonders in ulceration, and it can also produce albuminuria, which can be because of inflammation or because of a deeper pathology. So kidneys, and then we'll go ahead and we'll also see that this is also a remedy which has an affinity for liver. A better remedy? Very good. Children. Hardest. Naxxramica. Lycopodium. Yes, very good. Podopodium. Good, I'm happy. Bacteria, no problem. Fine. But what I want you to understand here is, calibrate is also a remedy which affects the liver. See what it causes. And you'll also understand how is it different from chelidonium. Okay, probably till here it can be chelidonium. It can be chelidonium here also. You can see fatty degeneration. And books also mention calibrate as a beautiful remedy for cirrhosis of liver. Okay, so chelidonium can be more superficial. It can be at the level of inflammation. Fine. And in calibrate you see the pathology going beyond inflammation. Please integrate with the knowledge of pathology. When you are reading systemic pathology, please do remember that there are a lot of things. Inflammation, hypertrophy, fatty degeneration, and of course, going further, there can also be cirrhosis of liver. Okay? Cirrhosis of liver. The last area I want to highlight is skin. Again, you know, the scope of homeopathy. I mean, though it beautifully affects many areas, skin is also one area where we have got beautiful results in clinic. So here, acting on the skin, you see pustular eruptions, pus-filled eruptions. Okay, and I know you know a better remedy. And which is a better remedy? Very good. Silicea. Hepa. Okay, good. Silicea, hepa, mud. Okay, calcareous silk. So pustular inflammation is what you see under skin. Now before I take up the second objective, is the first objective clear? Yes. How are you? Yes. In the original. Clear? Voice made? Yes? Okay. So what is that you see? Where do you see calibrate acting? Fibrous tissue. Under fibrous tissue you have cartilage and good. And third area we saw was? Fourth we saw the liver, and last is skin. Clear? So we will go to the next objective. What was the objective we had planned? We are looking at ailments from. See, luckily in Calibite, when I was referring the source books, you have only 4 ailments. You have only 4 ailments, and one is mixed, one is clubbed. So the ailments of Calibite, if you just look at the PPT, ailments from beer. And books also give ailments from liquor malt, MALT malt. So what is liquor malt? When beer has more amount of alcohol, then it is called liquor malt. Huh? Okay. So when beer has more percentage of alcohol, okay, then it is called liquor malt. So ailments from beer, ailments from liquor malt, or ailments from alcohol. Better remedies? So next is one top remedy you should remember. But here it is more specifically beer. And what happens because of beer in Calipari? They'll end up with gastric complaints. Gastritis or gastric affections because of beer. Okay? Gastric affections because of alcohol in general is more of Naxxon. Beer in particular is more of Calipari. Hope I am clear. Right? So tomorrow somebody comes to your clinic and he has got bad gastritis and he said, sir, yesterday was New Year party. So with friends I had 2 mugs of beer and then I landed up with gastritis. One remedy you can think of is Calipari. Okay. So the second very important thing, looking at the, okay, fine, sunstroke. Anything else that you can think of? Okay, hot weather. I have told you many times, please keep things simple. Okay, hot weather. Again, what remedies come to your mind? Hot weather. Brain. Natrofcar, very good. Natrofcar, sulfur, bryonia. Bryonia, when you have, from winter, must be Bangalore, now it is Jan. Feb, and it starts becoming hot. And March first week, people will come up with lot of problems. body pain, fever, viral fevers, and Brevenia sits on acute totality. If that is matching, the remedy, seasonal remedy can be more of Brevenia. Ailments from hot weather. Fine? Ailments from hot weather. Brevenia. Okay, and of course, you are talking about natrum car. What is it that you have in natrum car? And somebody was also shouting belladonna. Bell, natrum car, cantheris, these set of remedies, they are more of sunstroke. Okay? Temperature going high, fine, 40 plus, and a patient having a sunstroke. Okay? Now there is something very peculiar, very interesting happening in Calibi, and this is the only remedy mentioned in our Materia Medica after exposure or during that, hot weather. If a lady especially, if she is having uterine prolapse during hot weather, single remedy, and that remedy is Calibec. Okay? And before winter, especially in India, is the September, October, November, those months is what we call it as autumn season. So complaints during autumn. A better remedy? Very good. Why calcicum? So you see the flower, blooming during the season autumn. So that's the doctrine of signature. But they also observed, verified that colchicum has diarrhea more during autumn. So Calibi can also have diarrhea during autumn. Calibi also has diarrhea during autumn. So two small things we have covered till now. The first objective was sphere of action and pathogenesis. And the second objective, what we just spoke, and it's all there on the screen, is the ailment storm. Okay? Any quick questions? All clear? Boys? Okay. If this is clear, we'll introduce a simple third objective which was missing. And what is the third objective we are looking at here is the physical constitution of Calibi. Okay? Thanks to Google Images, you have an image. Now, as for educational purpose, the image has been taken, and what do you feel Calibi is more like? Obese, very good, fat, flabby. Okay, and what I also want you to understand here is people with short neck. This is very, very characteristic. People with short neck. Okay, so if people have jara, like a but no problem, good, no issues, at least. Okay, one remedy can be calculated first, good. The second remedy is natrum. Natrum also has long neck. हो सकता है, but see, arsenic क्या है ना? Arsenic is very fastidious. Everything will be proportionate. समझ रहे हो? Fine. In arsenic, there's nothing like one is short, one is small, or one is long. They are very fastidious remedy. So even the body thing is very, very proportionate. And this disproportion is what you see in lycopodium. Absolutely right. But I am asking about a person having short neck. See, short neck also means what? You can take it, make a note. In future it can be of some help. Short neck means people who are money minded. People? Yeah, now we are more curious. The girl is looking at her boy. Is he having short neck or not? Okay, sir. So many of them are looking towards their friends. Kiska lamba hai ki short hai. Chalo. See, what is important in people. See, there is something called as physiognomy. I don't want, not physiology. Physiognomy. Wherein from the body gestures, from the body makeup, it's a science where they decide. For example, you have big ear, big face, big forehead, everything, long, fingers, short neck, long neck, they have their own analysis, which comes out of experience, studies, I don't know what it is. But then please do remember, people with short neck, are those people who are money-minded. Money-minded people. That's what out-of-the-box information I have given. Don't write all this in your calibric exams. Short neck, they are money-minded people. Rakna, sirf Rakna first, okay? We'll decide. We'll see in the mind if calibrate is money-minded. Okay, we'll just see this a little later. Which are the money-minded remedies from our material medicine? Top remedy is brain, arsenic. They are very stingy people. That's how thoda concession de do na. Thoda kam karo. Pura family aa raha hai. Thoda kam karo. Right? Okay. Then, so money-minded, avarice, stingy people. They don't spend. If you it reminds me of a small incident, Bulbulaya 3. I have not watched the entire thing, I was just watching a small clip, and there the paste, everything. I really don't know if there are a lot of money in that thing, whatever. I am again trying to tell you, I have not watched the entire movie. But then the entire paste is whatever, no? They were trying their best to remove it. Fine? A toothpaste which has to be thrown out. They are all trying to do. See, if you don't have money, it can be a normal thing. If you don't have money, it can be a normal thing. You are rich. You can afford. But then you don't want to let go of even 1 mm or 1 mg of it. Then it becomes avarice. You getting my point? Then it becomes stingy. You have to be very careful. So, short-necked people, it also reminds of Cali carb. You all told Cali carb is done. It comes very close to Cali carb. Okay, how is Cali carb? Again, they are very fat, short, fine. And again, they are also the kind of people who have got dark complexion, fine. So, here it is light complexion with short neck disposed to catarrhal tubercles. What is this? They are the people who are more prone for all these discharges, cold, mucus discharges and all. Catarrh means people who are prone for all these mucus discharges. Fine. So, calibite, they are more prone for this kind of complaints. The interesting part of today's class or today's objective is characteristic symptom. Now, I hope you all agree that when we prove, patients come up with a lot of symptoms. Now, all the symptoms the patient comes up will not be characteristic. There are few symptoms which will stand out. I told you, there are few symptoms which are characteristic, which are unique, which are uncommon. Fine. So, we will just see what are those symptoms in Calibite which falls under this particular category. Now, what are those symptoms? The first very important thing, if you remember, we started with discharges. Right? Now I am unveiling the discharge in Calibite. You contributed a lot of remedies. I assume there is a doubt in your mind, what is the discharge that you have in Calibite? So if you have that doubt, so this is what you have to remember. The discharge in Calibite is basically very profuse. Okay, and it is stringy. What do you understand by the word stringy? Stringy means anything that can be drawn in form of a thread kind of a thing. Okay, ropey, that's the word that will come up next. Stringy, ropey, very sticky, glue-like, or it can be dried and it is generally yellowish in color. So the discharge from the nose, okay, the lady with leukorrhea, fine, or a man with gonorrhea, fine, or any discharge coming from the wound, post-nasal discharges, discharge from the eye, discharge from the ear, okay, cough, the expectoration, they all can have this particular character. I want you to remember minimum Stringy and ropey. Stringy and ropey. This is very important. Discharges which are stringy and ropey. Fine? Okay? Very, very important. Because till now, though some 70 remedies are over for you, I don't think you have come across any remedy having stringy or ropey discharge. I hope you understand. So that's why it becomes characteristic in calibrate. Okay? Patients come to you telling the same way, sir, dara tumba kashta agutte, ಎಳಿಬೇಕು, ಕೆಮ್ಮಿ ತೆಗಿಬೇಕು, ಕಷ್ಟ ಆಗುತ್ತೆ, ಒಂಥರ ದಾರ ಬರುತ್ತೆ. Not nore. Nore is frothy. This is more like a thread kind of an expectoration, thread kind of a discharge that is coming up, and that is calibrate. Hope I am clear. If you want, I can repeat, but this is very, very important. Very characteristic. Okay. The second very important thing is again very, very specific. Many times we have patients coming to our clinic. Doctor, मेरे को दर्द है, पेन है, बैक पेन है, इधर पेन है, उधर पेन है. तो हम लोग we ask them, कहाँ पे दर्द? And they say, doctor साहब देखो इधर. What is it? Doctor साहब देखो इधर. Yeah, good, very good. I am happy with your anatomy knowledge. But the material thing. Doctor साहब देखो itself इतना. Okay, so this is what we call it as pain in spots. Small spot. सिर्फ इतना डॉक्टर साहब. पूरा पेन में नहीं है. सिर्फ इतना. कितना इतना. इतना सा. सिर्फ here. Instead. It's not going down. It's not coming up. Whatever. So pain in spots. Like ropey. If you just see, I have highlighted this. This is very, very characteristic in calibrate. Tomorrow some patient comes. He shows his back and says, only that spot I have pain, doctor. And please remember calibrate. With your journey in homeopathy, you will be reading more and more remedies having pain in spots. But top remedy is calibrate. You also have oxalic acid that will be coming up next year. But for today, for second year, pain in spots is calibrate. Very, very characteristic. See, there is something which is periodicity. We have mentioned symptoms coming up periodically. What are the remedies? China, very good. Arsenic, Kali, Lyco. Okay. I mean, they all have very specific time modality. 4 to 8. Yeah, then that is periodical. Very good. Good thinking. Now, what is periodical in calibrate? Is what have I shown you here? Okay, neuralgia. Neuralgia, what remedies you are aware of? Okay, next. Causticum, allium cipa. So, how is it different from other remedies is, neuralgia daily at same hour. See, these are peculiar. Only a homeopath can treat such kind of patients. That's why देखो अभी 12 हो रहा है. हर रोज मेरे को 12 घंटे को exact 12 घंटे को इधर पे दर्द आता है. Fine? Yes, exactly 12 I am getting this. What is this? The neuralgic pains. So that is calibrate. Neuralgia exactly at same hour or periodicity. So in this slide we spoke of 3 characteristic symptoms and they are very, very characteristic. What is that first characteristic symptom? Stringy ropey, calibrate. Second thing is pain in spots. There is lot of other things. If you just see here, wandering pains which comes and goes suddenly, they are all there. I have not denied it. But for me, what is very characteristic in calibrate is pain in spots. Okay? And the fourth characteristic symptom what you have is gastric, alternating with rheumatism or respiratory complaints. Gastric complaints alternating with rheumatism or gastric complaints. Or respiratory complaints. Fourth one. And the fifth one. If Kali Karma is over, what is the time modality of Kali Karma?
2 to 4 a.m.
Okay, 2 to 4 a.m. Very, very characteristic of all Kalis. Now here what you see is 2 to 3. is what you have in caliber. Complaints aggravation between 2 to 3 a.m. Okay, हाँ वही बात कर रहे हैं हम लोग. So 2 to 3 a.m. Okay, so 2 to 4 calicar, 12 to 2 arsenic, 4 to 8 lycopodium. Okay, and this is 2 to 3. Okay, and then very important. What do you see here from the image? Pain in throat. Okay, good. Pain in throat. Pain in throat extending to the ear. Pain starts here and it is going till the ear. Any other remedy? Okay, phytolectra. No problem. Phytolectra. Pain in throat extending to the ears. I don't know if it is over or not, but remember phytolectra. Okay? And I'll show you another very beautiful image, interesting image. What is this? What do you see from the knowledge of anatomy? Uvula. What has happened to the uvula? Okay, one of your friends is showing this. Is it normal, abnormal? Abnormal. So what he was trying to tell us is the length. It is elongated. Very good. I could appreciate from his body language gesture. Elongated. Okay. So uvula elongated. One. Anything else that you also see here in the uvula? Uvula is edematous. Uvula is edematous. Edematous uvula, elongated uvula. One remedy. Swelling like bag is how your textbooks mention, and that is calibrate. You can also add another remedy here. Which is another remedy? Very good, beautiful, good. Very good. See, Tappu correct, it's my decision. But I like the speed, but I did not like the sound. Volume was low. So the remedy was absolutely right. She was very fast, quick in answering. The remedy is apis. Luckily my hearing is sharp. Otherwise I would have missed it. Apis mellifica. Other line never. Very good. So apis. Okay. So elongated uvula which can go into ulcers. Ulcerated uvula. See, many times, we miss examination. People are talking of throat affection. So please make it a point to examine. क्या है गले में? Fine. So is it tonsils? Or is it nothing, that there is nothing but they are complaining of pain? That's also a beautiful remedy. Which is that remedy? कुछ नहीं, सब कुछ साफ है, सब कुछ clear है. But अक्सर देखो, I know, Allah, I am not able to swallow.
Ignition.
What is it? Ignition. What is it? Ignition. Beautiful remedy. Ignition. Right? So, ignitia, everything is normal, but they are finding it difficult. And the beauty of ignitia is, आप बिरयानी दो, कुछ solid दो, बर्ते खाएंगे. कहाँ गया पर अभी दर्द है, पानी दिया. That's all. Amit, pani jab pee raha na, then you have pain. The beautiful thing in ignitia is, when they have to swallow their own saliva, it will be so much of a painful thing for them. But when they are eating something, they are absolutely no issues. One of your friends rightly used the word contradictory. Very good. Ignitia is a third remedy. Will not CBDC new syllabus. Because I am doing ignitia for your final year friends next Wednesday. So I was a little confused. Two batches going parallelly. And calibrate is also there for them in third year. You are lucky. What they are studying in third year, you are studying in second year. So ignitia is a beautiful remedy. Please don't miss. Young girls, hysterical girls. Fine, beautiful remedy. I have at least some 30-40 cases, cured cases, beautiful cases of ignitia. Okay. We'll come back. See, why I was trying to highlight this part is when you examine, the uvula can be elongated, edematous, or you also have this ulcer which can be giving rise to pain. That's how I am not able to swallow. It can be because of the ulcer. When I said ulcer, we had an image of ulcer. It was a coincidence. Now, Calibake is also a beautiful remedy for ulcers. Not only in the uvula, it can be on the skin. What is that ulcer you see in Calibake is ulcers which are deep. And books use the word punched out ulcer. What is it? Punched out. Deep. Okay? Fine. So what you see here is the ulcer is going vertically down. You don't see this spreading horizontally. Okay? So if the ulcer is horizontal, it is not Calibake. The ulcer should be more deep, meaning it's more vertical, punched out. So I'll just read what is given. Deep perforated, round, punched out. This is the punchline of Calibake, punched out ulcers. Okay, with overhanging edges or thick crust. The edges are thick, they can be overhanging, but the ulcers are deep, very important, punched out ulcers. Just looking at the ulcer, there are great homeopaths who prescribe, and this is what gives them confidence. Calibake, it is deep punched out. Okay. So before I close, what was the sphere of action? Mucous membrane. No, first is sphere of action. Mucous membrane. Fibrous tissue. Kidneys. Liver. Sphere of action. Why is clear? Second part is pathogenesis, which I am sure you are aware of. So we'll skip that and we'll go to the next thing. Ailments from? What is the cause for prolapse in Calibake? Hot weather. Very good. What is the cause for diarrhea in Calibake? Autumn. What is the cause for gastritis in Calibake? Good. So, what are the character of pains in Calibake? Pain in small spots. And then you also have wandering from one joint to another joint. Which is the better remedy? Pulsatilla, innovative, colchicum. Wandering pains. Pains which keeps going from one joint to another joint. Colchicum. Okay, of course pulsatilla, I am very happy you thought of pulsatilla. Okay, and then we spoke of alternating symptoms. Better remedies or other remedies for alternating symptoms? Aloe. Fine. So what is alternating in Calibake? Gastric complaints, alternates rheumatism or respiratory. Very good. And what we also saw is the desires of Calibake. I forgot to mention, they generally love alcohol. They like beer. And what they don't like is aversion, and that is meat. Aversion to meat. I forgot to mention aversion to meat. And it's a thirsty remedy. They feel like drinking water. Okay. And then we also saw that you have a characteristic ulcer. And what is that ulcer? Ulcer is punched out deep. Punched out ulcers. Okay. Perforating ulcers.